I'm here with Dr. Bill, our friend and dentist to the stars right here in Hollywood, and he's going to talk to us all about flossing. I mean, it really is important. I'm going to let you give the details, but from a medical standpoint, I know that diseases involving your gums can literally affect all of your body.
Absolutely. The problem is when you have plaque and bacteria sitting on your teeth, it causes gingivitis first. That gingivitis progresses to periodontitis. That's where you lose bone. But the worst part is that that same bacteria has systemic problems. And the systemic problems range from heart disease to preterm birth. We have a 700% increase in early preterm birth because that same bacteria passes through the placenta. It can actually trigger your labor. And the problem is, people think that, you can just brush your teeth and get it all. But you're missing a lot of that dangerous bacteria that's in between the teeth. So you absolutely have to floss. Now, most people take the floss and they go in between their teeth and they stop at the gums. Why? Because it bleeds. You can't do that. What you actually need to do...
You want to see a little blood.
Well, if your gums bleed, it's because you're not flossing right. So eventually that will stop.
All right.
But don't get scared if you're having a little bleeding. What you need to do is you actually need to go in, wrap the floss around the tooth, and go down underneath the gum, up and down 3 times, lift it up, and then do the next tooth, 1 to 2, 3 times. And then you'll be getting all of the plaque out. So you have to brush and floss. How often? I floss every time I eat. I mean, I'm not going to carry a toothbrush around, but I always keep floss in my pocket.
This is a pretty big brush here, Dr. Bill.
That's a big one.
Anyways, we have an animation that we want to show to sort of summarize some of this that you just said about gingivitis.
So what happens is the bacteria sit on the gums start to get red, they get a little bleedy, but the worst part is that that same bacteria enters into your bloodstream and it travels to your heart. That same plaque that you have inside your heart is the exact same bacteria that you have around your teeth. So you have to floss, you have to brush, get it out of there, you'll be a lot healthier. It's kind of like this low-grade infection. Like if you leave your car light on, you say, well, that's not a big deal, but overnight, the battery dies. If your body is fighting this chronic disease for years and years and years, we have an increase in cancer, diabetes, arthritis, pneumonia, I mean, on and on and on. You got to get that bad plaque out of there.
I don't know about you, but I'm going to floss tonight. Get on that flossing.
I'm going to call you and check.
Okay, thanks, Bill.